Welcome back everyone. Hope you all are doing good. Today's project is a randomized comparative study to evaluate the efficacy of homeopathic treatment versus standard allopathic treatment for acute lymphadenitis due to lymphatic filariasis. This study was done by Dr. Jaya Gupta and team of CCRH. We all know lymphatic filariasis is a vector-borne disease caused by Wuchereria baumannii. It is a common social, physical, psychological, sexual and economic problem which can lead to deformity and also acute recurrent febrile illness. Due to this illness, many people's quality of life goes down. So, when we consider the standard allopathic mode of treatment, the anti-filarial drug, that is diethyl carbamazine, is used commonly. There are multiple short-term adverse reactions like fever, headache, myalgia, vomiting and asthma. Regarding this, to overcome the side effects or the short-term adverse effects of the anti-filarial drug, CCRH between the year 1980 to 2003 conducted a multicentric clinical trial, but there was no diagnostic and scoring techniques used. Therefore, this team under Dr. Jaya Gupta have decided to go on with the study, including 2 assessment criteria and diagnostic criteria into the work. The objective of this study is to assess the effectiveness of homeopathic medicines in acute adenolymphangitis comparison to the standard allopathic medicine using ADL scoring scale based on the 2 days, that is first day and the 11th day of treatment. The second objective of this study is to study the reduction in the frequency, duration and intensity of subsequent attack, if any, and also improvement of quality of life using WHO's quality of life brief questionnaire. This study was a randomized open label comparative study. It was conducted in the Regional Research Institute of Puri, Odisha. This study was conducted between the span of October 2012 to April 2014. Initially, ethical committee approval was obtained from the CCRH. Informed consent form was obtained from the patients. The project was registered under CTRA and consultant medicine specialists were also appointed. Further, for the study population, both males and females were included between the age group of 15 to 60 years of age with the local symptoms, that is pain, tenderness, local swelling, warmth, with or without constitutional symptoms, that is like fever, nausea, vomiting within 72 hours, with or without history of acute adenolymphangitis. The lymphedema shall be in the grade of 1 or 2. The cases with the grade 3 or 4 lymphedema were excluded. The cases with hydrocele or lymphadenitis due to different infections like thrombophlebitis, trauma, ascending lymphangitis were being excluded. Other systemic illness, patients with other systemic illness, patients after treatment for acute lymphadenitis were found to be unfit for the study. A total of 143 patients were considered for the study. After considering the inclusion and exclusion criteria, 112 patients were found fit for the study and included, whereas 31 patients were excluded as they were not matching the inclusion criteria. Further, the 112 patients selected were then randomly placed into 2 groups for homeopathic and allopathic treatment, where random number method was used. After allotting the patients into 2 groups, the study continued for a period of 6 months, where homeopathic group did not have any dropouts, whereas in the allopathic group 5 dropouts were there. So the total number of patients taken into the study and continued until the end of the study for the homeo group is 55 and for allopathic group is 52. The examination and investigations included in this particular study is for the physical examinations, local examinations for the area affected were done. The investigations included for the study are hemogram with ESR, nocturnal peripheral blood detection for circulating microfilaria, immunochromatographic test for filarial antigen, and routine stool and urine tests were conducted. These tests were followed on the base day, that is in the start of the study, as well as on the 11th day of the follow-up. Interventions made in this study are based on a shortlisted group of remedies which was selected based on the previous work done on this illness. Allopathically, an antibiotic, an anti-inflammatory, anti-allergic and anti-filarial drug were used in this particular project. A total follow-up period of 6 months were taken into consideration and the total study was completed in a span of 18 months. The outcome was assessed using ADL scoring as well as WHO QOL brief scoring. The outcome assessments were done on the day start of the study as well as day 11 as well as after 6 months. The statistical analysis used in this particular study is independent t-test to find out the group difference, paired t-test to compare between the different time periods, and as well as ANOVA for comparing two proportions. The results thus obtained for this particular study using ADL scoring are as follows. Both the groups showed 90% improvement between the day 1 and the day 11. There was no significant difference between the groups, but both the groups are equally effective. The homeopathic group showed 11.91 plus or minus 2.99 on the day 1 and 1.11 plus or minus 0.98 on day 11. Allopathic group 12.26 plus or minus 3.13 and on day 11 1.33 plus or minus 1.41. So the improvement was equal in both the groups, but there was no significant difference. The lymphedema between the groups, if you see, in homeopathic group, in grade 1, there were total 25 patients. Out of them, 13 showed very good improvement. In grade 2, there were 29 patients. Out of them, 21 patients showed a significant improvement. In allopathic group, in grade 1, there were total number of 30 patients where 12 showed a significant improvement, and in grade 2, there were 26 patients where 17 showed a significant improvement. The next criteria which they wanted to understand is the frequency or the recurrence of the episodes among the patients. In homeopathic group, around 16 patients showed recurrence, whereas in the allopathic group, there were 18 patients who showed the recurrence, which stands to 52.94% in allopathic group and 47.06% in homeopathic group. If you see the remedy profile, the commonly used medicines were Apis mellifica, Rustox and Pulsatilla. Apis mellifica was prescribed for around 23 patients, Rustox for 20 patients and Pulsatilla for 8. Other remedies prescribed in this particular study are Arsal, Bryonia, Hepaself and Silesia. During the span of treatment, initially acute remedies were prescribed, followed by constitutional remedy after the span of relief, where Natramur, Lyco and Sulphur are the constitutional remedies commonly appeared among the Apis group, and Sulphur and Lycopodium are the common remedies appeared for the Rustox group. The quality of life assessment scale was used to assess the quality of life among the participants. The assessment was done in the day 1, day 11 as well as day of 6 month end. If we consider the results of all the 4 domains, all 3 domains were exactly similar between the allopathic group and homeopathic group. In the 4th domain, homeopathic had a better upper hand compared to allopathic group, which was significant with the p-value of 0.004, which is statistically significant. So the understanding of this particular study is the recurrence of the episodes have come down equally both in allopathic as well as homeopathic groups, as well as the efficiency in treating the condition is also equal among the homeopathy and allopathic groups. Rustox is found to be more effective among the patients of Puri district. The further scope of study in this particular aspect is including a multicentric study, including a larger group of population, as well as immunological study and lymphoscintigraphy. Therefore, this study proves homeopathy is equal to allopathy in treating acute adenolymphangitis. So this is the brief of the work conducted by Dr. Jaya Gupta ma'am and team. So I request all the viewers to post your questions in the comment box regarding this particular research, which will be clarified by ma'am itself in the next upcoming video. Take care. We'll see you again with another informative session.